Hi guys, welcome to our podcast. We're gonna call this Doctors Unplugged. What you think about that, Dr. Nello?
Yeah, man, I'm with it. Doctors Unplugged, Doctors Unhinged, whichever variation we go with, I'm with it. What do you hope to do with the podcast? That's my question.
I think we could get a good patient outreach. I think I'm hoping for education on the basic things. Right? You want people to know that when you're having an immediate stroke, you're not supposed to come to the clinic but go to the hospital. That sort of thing. I'm thinking.
Yeah, I mean,
you know what I mean?
That's good.
Yeah.
I get it, but like, I also just want us to talk about like, I'm gonna call it the dark side of medicine. You know, like the things that people don't talk about on a regular, be it from the doctor side or the patient side. I want us to like just, nothing is off limits, right? So unhinged, unplugged. Let's just discuss everything.
No, I like that.
I'm with the first part, of course. Please don't cancel me. Listen, if you're in a dire situation, it's very important you know where to go. But I want us to address everything across the board.
I think that would be nice. That would be lovely. Yeah, I'm going to start with some introductions. Can you tell us who you are, where you're from, where you practice?
Right. So my name is Dr. Nelson Mayamba. I was born in Zambia. We moved to Botswana when I was 8, so that's about 20 years ago. I currently am at Kalafhi Medical Center, and I am a general practitioner. Fun fact, I've known the lovely Dr. Michael for a while now. We went to med school together, that's why I met him. So incredible guy. But tell us more about you.
Shout out. I'm Dr. Michael Nyoni. I am also a general practitioner at Kalafhi Medical Center. I've been with them now for about half a year. It's been lovely. I went to medical school as well with Nello. I came to Botswana in 2004 when I was also about 8-9 years old. Good times. This place is my home. I love it here. And it's been great to work with and serve the people. So that's nice. Yeah.
Good man. Man.
So, moving on to the podcast.
Sorry,
can see how awkward we are
before he goes on, I just want to put it out as a disclaimer. We have never done this before, okay?
Right.
My first time doing a podcast, same with Mikey. So bear with us. We don't want criticism in those comment sections. It's our first time.
We're soft people, man. Don't be out there fighting. All right. We're soft people. Take it easy on us. All right. But to just jump it off, right? What inspired you to be a doctor? I think that's a good place to start, isn't it?
To be fair, I think an interesting story is that both my parents are nurses, right?
Sweet.
And the norm is always, okay, both your parents are nurses, so you became. I'm like, no. I actually wanted to become an engineer at first. But math, mechatronics, I think, robotics. So it's like medicine but for robots.
Right.
So I think I always had the heart to like help people or things in terms of robotics, but I was just never with it because my parents were nurses, right? Fast forward as time progressed, I wanted to be a lawyer. Yeah, because I did debate and stuff in high school. So I was like, listen, I could argue myself off in any courtroom. Oh, sweet. Then I realized how much reading there has to be. So listen, I mean, medicine has reading, but like for the most part, it's not as intense as law. All that section this or section that, I was like, nah. Yeah. And truth be told, I've just always had a heart for helping people.
Right.
Don't care much for what comes with medicine. Right. The title, the whatever and all that stuff. I just genuinely just want to help people. So it's a perfect platform to do so, and here I am. Thank God.
Oh, good, man. That's actually an
inspiring
story.
What about you? Yeah, why are you here?
Do you know why I said shout out when you said mechatronics? It's because I wanted to do the same thing. I actually applied to UCT for mechatronics engineering. I got accepted in my first year of A-levels. And then I also did the Rakus thing. We can't promote them, so I'm going to cut that out. I also did the Russia thing. And I get into the uni, and I think 3 months in, my mom is like, doctor, do you want breakfast? Doctor, do you want dinner? Doctor, do you want this? Yeah, so I realized the sparkle in her eyes every time she says, doctor. Yeah. I'm like, you know what it is? I could just do this, at least give it a try to just see how proud she could be. So I literally got into first year because I want to make my mom proud.
Nah, that's beautiful, it. Shout out Mumsy. Moms always have our hearts. Yeah. That touched a place in my heart,
It's an authentic thing.
Yeah. Shout out, mom.
Yeah.
Truth be told, there's no respect that comes with being a doctor. Harmo chopis, spa,
Bro.
pick and pay. We all queue in the line. In the bank, we all queue in the line. There's nothing that comes with it. Okay. So if you're trying to be a doctor or encourage your kids to be a doctor, I'm looking at you in the camera.
Show this to your mom.
Please do it if you have the heart for it. Otherwise, don't. There's no money in medicine. There's no social life. Nothing. You literally sacrifice. Listen, let me put it this way: you are setting yourself on fire to keep the world warm. Okay, there's nothing that comes with it.
It's service.
Yeah, that's all it is.
Yeah.
So, I mean, this is a great gesture. Like trying to make Mumsy proud. Same with my parents. I mean, I know they're proud of it. But if you're doing it for the wrong reasons, you will stop halfway. So unless you have the heart for it, don't do it.
No, 100%. I think what pushed me was, in second year when we had that histology. So histology is like a thing where you're studying tissues, and we had these crazy, strong, strict teachers, and you're moving in the snow to go for a lecture and things like that, and you're basically the motivation has to come from within. And that's when I realized that my thing has moved from trying to make Mumsy proud to this is something that I actually love doing. I love showing up. I love showing up in those lectures, those tests, those exams. I love being there because this is something that has automatically become interesting to me.
As a patient of Dr. Michael, I absolutely vouch. I quite, and this is not even being biased.
Yeah.
I have issues with going to the doctor, being a man.
Yeah.
Also, men, stop doing that thing. Go to the hospital.
We need to address that.
Yeah, we need to stop doing that thing. But yeah, it was absolutely a pleasure. Probably one of the only doctors I would go see. So, unless you have the heart for it, man, don't do it. Don't do it.
It's not worth like pushing it like that. Yeah. All right. And then how did we meet? Actually, do you remember how we met? Because the question is supposed to be how did we meet and decide to start the podcast? But you know what it is? The most important bit is like, do you remember how we met?
I think
because we probably have different narrations.
Yeah, I know we probably have different. We never discussed about this until now.
Right.
I think from as far as my memory would allow me to recollect, I got to Russia I think a week or two after you.
Right.
So you were kind of already settled in. You know what was what and what was going on. I don't fully remember the interaction, but I remember meeting you, and I'm like, my goodness, this guy's so vibrant, and like he looks like he's been here for time. Proper welcoming, man. I felt at home. That's as far as I can recollect. Yeah. But like you proper made me feel at home. You told me like, listen, if you need anything, this is where to go. Come chat to me, talk to me.
Hit us up.
This, that, and the third. I wouldn't have imagined that years later we would be in this exact position. But God is good. Yeah. God is good for sure.
That's sweet.
What was your recollection of our interaction?
I remember that so I got to Russia, and then we were there for about, I think from Thursday until like the Sunday or something. I think you guys arrived on a Monday or a Tuesday, and then they were like, there's some guys from Bots. And I was the only guy from Bots that had arrived because I came with a bunch of girls. Yeah. So I remember thinking, you know what, let me go meet the mandem. Yeah. So I get there, I see you, I see Chief.
And Wale was also there.
I see Boyle as well.
Also doctors, by the way.
Tafara, all doctors, all absolutely great guys, right? Shout out to you guys. We'll put your Instagram somewhere on the link in bio. But still, I remember then I remember seeing you, and I was like, then we had a chat a bit, and then you told me about your music career. You told me how you was pushing music and things. Yeah. I was like, this is a great guy. Like this is a super talented, phenomenal guy. It's like in grade 3, my uncle told me always make friends with people that are better than you at things, right? So that that pushes you and inspires you to do better. You're never complacent at some point. So I was like, wait, listen, man, this is a cool guy. Let me befriend this guy and then try to learn a thing or two from this. So that's how I remember being friends with you.
I didn't even know that.
Yes, and I remember because you showed me a dance video of yours as well.
Yeah,
from before that. Yeah, I used to teach dance as well. Yeah. So that's when we
before
became
old
friends.
age caught up.
There's
that phrase. What is it? If you're the smartest person in a room, then you're in the wrong room. Yeah, it's always been a position to learn.
Yeah. So there's that. Yeah.
Interesting.
Yeah.
Interesting. You know what it is? I have questions.
Let's go.
Yeah, I have questions.
Right.
I have would you rather questions and I'm so hyped to hear your opinion on these.
Okay. Shut up.
Let's start simple and light, right? Before we get into the unhinged part. Would you rather work the morning shift or the night shift?
Night shift, definitely. Night shift.
Why?
It's exciting. Night shift's exciting, man. Do you know what it is? Yeah, in morning shift, let me tell you what happens in morning shift. Morning shift is about 50% of guys coming in and being like, I am not down to go to work. Please give me 3 days off.
I had the sick note, Oaks.
Yeah, it's 50% of the guys are just in for like, yo, just hook me up, man. And they're not even really sick, right? And then you get like the good 20% of the old ladies that are coming in for like their hypertensive medication. Shout out, because that's good. But at night, anything can come in, man. I had a kid the other day, dog. I don't know what he had been walking around and then he fell into a ditch. He cut himself on his head over here. He was bleeding. So you know how your face has the most blood vessels around your body, so it bleeds profusely. Even if it's a small cut, the bleed is like crazy. So I get on there and I'm like, okay, cool. We're gonna stabilize him, wipe him up, clean him up, and then put a few stitches. He's 8-year-old. Okay. I put a few stitches on his head, and then it goes away, and then we just bandage it, and he's all good. And this is a kid that came in thinking his brain is out of his head. But like it's like exciting, it's like it's fun stuff. And in the morning, you never get that stuff. In the morning, it's mostly doctor. I give it at the wrong, I'm tired, and that's that. What about you? What would you like? Morning or day shift? So day shift or evening shift? What are you taking?
That's a tough question because I don't necessarily mind doing both. I'll actually be honest and I'll say this. I mind the night shift not even for the reasons that you. Granted, all those seem like action and energy and things to do, and like you go from like 100 to bring it down to a 0, but I feel like, the day shift can be dragging, mate. Like anybody that knows me knows I really don't do well with like administrative work, like filling in forms and like checking boxes is really not what I want to do. I want to do what you're doing, like get my hands dirty and help people. Right. So during the day, it's just a lot of. Yeah, can you fill this form? Can you do that? Can you do this? I don't mind. You can listen. You can come in.
Please keep coming
and sign your form. I just personally don't enjoy doing it. I think that being said, I'll probably prefer the night shift. Crazy enough. Yeah. I have one more for you. Speaking of the night shift, day shift.
Okay, right? Go on.
Would you rather do a 24-hour shift with only instant coffee? Or spend 12 hours in a clinic with one overly chatty patient who always forgets their medication? So they're talking for time, but they don't even know what their meds are, which happens, and it's okay.
Imagine doing a 24-hour call in Marina, right? That's the only... You don't have time to eat when you're doing that, right? You're proper hopping in there, and you're like seeing a lot of interesting patients and things like that. So I think it's a good opportunity to help a lot more people than to sit with one person for a whole 24 hours. I think I'd get proper bored from that. I'm just going to sit down with the patient and it'll be proper banter from there. Yeah.
You know what it is? Pardon me. Yeah. So by the way, we offer home services, as in we can consult you through the phone and come to your house.
Shout out.
All right. So that's what I was doing right now. I apologize for interrupting the podcast, but I agree with Dr. Michael.
Yeah.
I would rather be on that 24-hour shift. And don't get it wrong, like listening probably my greatest attribute, but if you were to morally think about this, if I was to listen to someone for 2 hours versus potentially save 10 lives, I would rather save the 10 lives. So sign me up for the 24-hour shift any day.
Okay, sweet.
Any day.
But speaking and chatting about the 24-hour shift, you've seen what's going on with BDU and that?
Yeah, you know what? Let me start off by saying this. Solidarity. I'm with BDU. Fight for your rights. Doctors' rights matter. We don't get paid enough. If you think doctors make money, I want you to text me and DM me, and I'll tell you that they don't. They don't make money at all.
I was going to say, go and look at the parking lot. Look at the parking lot at Marina. If you think doctors are making money, look at the parking lot at Marina. And then if you think that's fair, right? Come work as a doctor as well. Come stand for a 24-hour shift so you can drive a Demio.
Because you would think you'd find like Ferraris and Lamborghinis. Man, that's not.
And what are you asking for that?
I think that's a very, very realistic approach to it. Like, just go to parking lot marina and like look, and you realize that these people are not. They're not. Because you know what it was, when I heard about, because it didn't just start now, the whole thing, because people assume that it did. It's like tapping back to Russia and Ukraine, wishing them love and away with the war. But that started when we were going to school back in 2014. Yeah. It's like when people chat about it now, saying like, oh, Russia, Ukraine, this, and this. I'm like, this started time ago.
You're getting it mainstream now.
Yeah, like you're getting it now, but like it started time ago. I managed, and you managed to go through med school for 6 years. Yeah. Unfazed, to be sure. I probably had the time of my life.
Didn't care.
In Russia. Like the tariffs worked in my favor. But what I'm trying to say is everything you see is not necessarily reality. And I appreciate the BDU for like doing the interviews and trying to shed more light. Yeah. Because there's this notion that doctors have money, so why should they be fighting for more money? Doctors' rights matter. Right. You understand? Like you would work your normal shift and still have to be 24 hours deep on call, manning a lot of people. And like with all respect to other professions, right? Yeah. If you make a mistake, it's somebody's life.
That's right.
Right? Like you can't afford to make mistakes. Now imagine you're dealing with someone that's fatigued, functioning on caffeine or energy drinks. It's really not the right person that you want to be doing that. Yeah. And to do that, Jay, out of service is a bit much because you're already underpaid. Yeah. Right? I mean, in comparison to the tariffs in South Africa, they get paid ridiculously more. So I'm just here to put it out into perspective that doctors don't get paid half of the work that they do. Yeah. So if you can, please stand in solidarity with the people in BDU and fight for doctors' rights, man. Yeah.
Support the cause, man. You don't want a guy driving a Demio to be operating on your mums. I'm telling you that now, because that guy is tired and he's gonna go and do a shift to GPH as well from here. He's rushing that process because he's not getting paid enough money. So pay them.
Demios are good cars. I'm just gonna put it out there. Demios are great cars. Thank God you're driving a car as well. I'm like, let's. Demios are great cars.
Right. I'm just. It's a bit personal. But I'm just gonna let it go. We're gonna find out what car I drive later on during the other episodes. But still, just make sure you do the right thing. Support BDU. BDU is doing the right thing, and I think people should get compensated for the work that they do.
Nah, easily, man. They work way too hard. Yeah, but that's another thing as well. Right. I'm gonna go off script with this. Have you clocked like, noble professions really don't get paid what they deserve to be?
They rarely get paid.
Think about this, right? Like your average footballer. I mean, I say average, but like your up there footballer gets paid crazy amount of pounds or dollars every week, even if they're sitting on bench as well. You understand? Like contractually, they're gonna get paid. But you, the guy that's gonna make sure they play, or you, the guy that saves a life versus kicking a ball. And I'm not even like throwing shade to them. Like it's an important thing. Yeah, I get it. But like entertainment and sports tends to rack more than noble professions. Sure, you're a judge, you're a police officer, you're a soldier, you're a doctor, whatever noble thing that you're doing, it doesn't rack in as much as entertainment or sports would do. And I understand that more people are tapped into viewing that, but it's just me reverting back to the point that I was saying is, and this is because I've had situations, right, where parents would be in with their kids, and I have a question on that. Where they're like, oh my goodness, look, he's a young doctor. You could be a doctor as well. I'm like, no.
It's not that easy.
No. Tell your child to actually make money. Like, go study business or economics or finance.
Then own a hospital after that.
Yeah, like you could literally own the same. You could employ me. Yeah. You understand? Like, you don't need to go through the motions for it. Yeah. But speaking about that, what's probably your favorite demographic in terms of consultations? Like, what are you happy seeing? I know it's an unhinged question to ask because you must be happy to see everybody, but I'm sure there's like a particular fave that you have.
Do you know it is old ladies?
Why?
I promise you.
I mean, I get it, but like, why?
Do you know it is old ladies are the most pleasant people to see? So they come in, they're patient, they'll listen to you if you give them good expert opinion,
and they know their medication,
bro. The man that
one of my 30, 40-year-olds, you all need to do better.
What are you taking? It's a blue inhaler. That's all you take. You're taking that every morning. Have some shame. Have some shame. just, do better.
Yeah, but shout out to the old ladies.
Yeah,
Appreciate
old
you.
ladies come,
Love
they'll
you.
tell you I'm on 1, 2, 3. They'll tell you the dosages, how often they take it. Those are good people, man. I love those old ladies, and that's why they live so long. That's actually why they live so long. I've only had one male patient that was over the age of 90.
Really?
Yeah, he was 95.
I've had a couple of them same experience, but there's one old gentleman.
Yeah.
That. So let me tell you this, right? I think I've told you the story. I had a 2-year-old that couldn't breathe, right?
Okay.
And I'm busy like trying to resuscitate this baby. Undiagnosed asthma, because you can't diagnose asthma until age 5, 4. I could be wrong. It's been a minute.
Right.
But like at 2 years old, you're not going to diagnose asthma. The pediatricians can vouch for me. Please do. So I'm trying my best to like keep this baby alive, right? And on average, your consultation time is probably 30 minutes.
Yeah.
So I come back into the office after getting the baby to breathe again, and I literally went, time for the next patient, right?
Yeah.
So I call reception, like, yeah, you can send the next patient. This man walks in with a bunch of paperwork, and the first thing he's saying is, La Dieja, hey, you're taking time, this, and this. Brother. I'm like, and me being me, like anybody that knows me, I'm like, yeah, I'm literally sorry I took time, which I don't need to do, by the way. I'm like, I'm really sorry I took time. I was busy with an emergency.
Yeah.
He ignores everything I said and continues to like keep rambling and complaining about whatever is going on. And I look at what he's holding. It says transport forms, right? So I literally tell him, like, listen, if every patient I had to see was like literally filling in forms and ticking boxes for transport or whatever it was, I'll probably be the happiest doctor on earth.
60 patients a day. You're wrecking it.
Listen, I'm stacking and clicking those boxes every single day. But I was like, I literally had an infant to deal with. Probably took the life out of me as well because I was a bit flustered after it. And I literally offered him, like, listen, I can go show you what I was doing. Like I was with a baby right now that wasn't breathing.
Yeah.
And I'm hoping the human side of you will like relate and be like, oh no, I understand. I'm sorry. It's okay. Thank you for apologizing. No, he kept on like pushing. And I have an insane amount of patience, right? Like I'll tolerate anything. I remember that day I was like, I genuinely can't anymore. I remember that particular day. I'm saying this for the podcast. I took my stethoscope off. I gave it to him. I'm like, you can see the rest of the patients.
I'm done.
Since you know what's going on. And I walked out. And when I stepped out, there was a couple of patients that know me. So reception's like, where are you going? I'm like, no. You guys' new doctor is inside. You guys can go see him. And I stepped outside
that
just to catch air.
Yeah.
It does, because that's not me. Reception came out and talked to me and said, no, like, what's going on, blah, blah, blah. Go back and see the patients. And I'm like, I remember talking to her and saying, it's like people forget that we're human beings as well. Like, I'm starting off by apologizing to you, which I don't need to do because I took an oath to do no harm. Like, if I have to sit and spend 3 hours getting a baby to live, a middle-aged person or doesn't matter who, if I'm taking 3 hours to save a life, I'll do it regardless, right? But if you're gonna come and like give me stick for saving somebody's life is a bit much. So I was like, listen, I can't. Like I've had enough to deal with today. Like since it seems so easy to you,
go ahead.
Go ahead and go on, do your thing.
Sign your transport forms.
Go ahead and do your thing. So eventually she talked to me and I was like, you know what, I've got my patients by reception. I'll just go back in and like do it. So I get back in and he was like, yeah, no, I'm sorry. Hey, this and this. I'm like, I'm gonna say this to you now, and I said it to him and I'm gonna say it now, right? For me personally, respect is a two-way street. I don't care if you're 5, 20, 30, 90. If you're not gonna dish out respect, you're not gonna get it back. It's a two-way street. I remember signing his forms. I remember telling him, you should be grateful I'm signing these things the correct way, because I could tick no, and misplace the stamps on purpose just so you have to come back again. But I think the moral of this story is really touching base on be kinder to your service providers. Right. Because when I'm in like Spar, Choppies, Pick and Pay, whatever it is, I'm always like nice to the tellers because I know what it feels like to be on the other side. So be nicer to your doctors and your nurses and your healthcare practitioners. That being said, my favorite demographic is kids. I love the old people. That's my second option. But kids, like, I mean, sure they'll cry, sure they'll be afraid, but like they're such pure, innocent souls, man.
Sweet.
You see the middle-aged ones, liars. They will lie. There's a brother that I once saw. My man came in and said, I'm having symptoms of like a urinary tract infection. And I'm like, yeah, that's a bit off, because, UTIs are more typical for women. They have a shorter urethra, about 4 to 5 centimeters. Male is about 20 centimeters. They have to sit to urinate. You have to stand. So how did you pick this up? He's like, yeah, no, it burns when I pee. And quoting Dr. House, all patients lie. Okay, all patients lie. So I approached it the right way. I wrote him down to meds to help with the burning sensation,
right?
Citrus soda to neutralize the acidity, and painkillers to reduce the inflammation. But I held back on the antibiotics because you shouldn't get antibiotics for everything. Influenza is a virus,
bro.
A virus. It has nothing to do with bacteria. Okay, I'm just gonna put that out there. And
it doesn't matter what your previous experience is.
Yes, don't say my last doctor gave me antibiotics and.
Bro. I feel it. I don't care what you feel. Do you know what I mean? This is not the right thing to do.
Yeah, because there's a whole epidemic on antibiotic resistance. Okay, the day you need them, they're not gonna work. My man came through. I said, let's go do a urine MCS. So that's microscopy, culture, specificity.
Right.
Let's put under the test. Let's see if there's actually any bacteria in there. Let's grow it. Let's see what antibiotics work. The right thing to do, right? Came back clean.
Of course it did.
Before I could tell him the results, my brother came in and said, Doc, I'm having this testicular pain. I'm like, testicular pain? You told me it burns when you pee. What's going on? No, I forgot to tell you. I might have had unprotected sex.
Fair.
I'm like, why didn't you just come in and tell me this so we can avoid? Again, moral of the story, just be honest with your doctors. Like, just tell them what it is so we can save everybody time. All patients lie, but we choose not to believe that narrative. We believe that you're
the one honest person.
Yeah, you're telling us the truth.
That's right.
But my thing is middle-aged demographic, no, too many liars. Old people, love them, easily my second. But kids, because you just clock from what they're crying about, their symptoms, how they look. You can tell a lot from the nonverbal discourse. So I think my heart is with the kids. I don't have the patience to be a pediatrician, not just the patients, but it's the heart, Chief. Like, imagine, let me put it to you this way, right? If you had an 80-year-old patient, high blood pressure, diabetic, cancer, terminal stage, and you lost them, it's like, it's sad that we lost the patient, right? But
they've lived their life.
80 years they've lived.
Yeah.
And they had a lot of chronic conditions. So, there's only so much we can do.
Not to say that
lives don't matter. I'm just trying to create a narrative. So that's 80.
Yeah.
And then you have an 8-month baby or an 8-year-old baby that just passes away. It's like, I don't think I personally have the heart to be able to sleep after that. Because I'll keep asking myself, what could we have done more? So, pediatricians, love and respect to you guys for all that you do. My favorite demographic is kids. But it's also a tricky demographic to have. I think beyond kids, I'll probably agree with you with the kids. I know it's in a long tangent, but I had to get a lot of things off my chest, and I'm glad that I did.
You seem like you have a lot to uncover there. But that's something from every episode, isn't it? Like, we want to expect a good story from either Dr. Nalo and I about something nice that's happened or something that's terrible that's happened.
Stop lying to your doctors. That's what I'm going to say. I'm looking at you in the camera. You
know yourself. I think the two people that you shouldn't lie to, isn't it, is your lawyer and your doctor.
Yeah, for sure. And God.
Sorry. Yeah. But no, I said people, because not deities, but people. Yeah.
I'll give you that.
Yeah, they'll have that. So I think those are the people you can be honest with. And not only that, but we're bound by law to keep your secret. So whatever you come and tell us, we can't tell your husband, we can't tell your children, we can't tell anybody. Unless it's that you're going to kill somebody. To be fair, that's Yeah,
it's a bit dark,
patient safety. Yeah, it's a bit. Now, do you
Speaking
know
of what if?
Okay, go on.
I have another.
Would you rather?
Yeah,
go on then. Yeah.
Would you rather? I'm not going to answer this question. It's all on you.
Okay, fine.
Would you rather be
mind.
trapped in a psych ward where you're the only sane one, but no one believes you, or be insane, but everyone else trusts you with your lives?
Be insane.
And everyone trusts you.
I would rather have that. You mal. Imagine. Imagine being in a psych ward. Imagine being in a psych ward, and then you know you're good, and everybody's like, nah.
To be fair, I think that's a relatively...
Bro, you've seen those stories where somebody's innocent in prison, and then he's like,
yeah,
I didn't do it, and they're like, oh, bro, we all did.
Everybody says that.
We all did it, but you actually didn't do it. So I'd rather have done it, and then people believe that I didn't do it, man. I was like, I think that's better.
Okay,
yeah.
So I know you don't have kids right now. Not married as well, right?
Shout out to...
Yeah, marriage first and then kids after.
Yeah, that's stepwise, isn't it?
Yes, trying to follow the right protocol. Would you rather cut off your dominant hand to save a dying infant, or walk away and keep your hands clean, literally? This is from ChatGPT, by the way.
Man, screw that ChatGPT.
I know.
That's a big ethical question.
It is.
Okay, potentially, with my dominant hand, I've saved a lot more people than I've led to their demise. Not intentionally, by the way, but like I probably would rather keep my dominant hand just so that I could, because I could potentially save a lot more patients with my hand than to cut my hand off for a child.
That's that ethical question about the train, right?
Yeah,
the
so it's like, are you hitting one little baby or
5?
Are you hitting 500 people that have lived their lives and they're 80 years old? Yeah.
Did you like horror movies?
No.
Okay, good. Would you rather do a full night shift in a haunted hospital, ghost and that, like every step you take,
okay,
or work the day shift in a fully functional psych ward without meds?
You know what? I just imagine you as the doctor in Sinners. Did you see that clip when they're outside there and then you're the doctor there and you're
no, thank you.
So you're going to the psych ward.
I'll take my chances. I'll lock myself in a room, Do
you know what?
I'll pretend to be crazy and just join the gang.
Do you know what? No, but they can smell it. That's how the vampires are. They can sense it off you. So if you're outside, you're at risk of turning into a vampire. I can't lie. Me?
I'll be a vampire.
I'll be a vampire. I can't lie. Yeah, I'm not wasting time fighting.
They won, bro.
Yeah, they've won.
Yeah,
dog.
that
they
hero
have more
stuff.
Numbers. Yeah. I'm being a vampire, dog. I'll be a vampire. That's fine.
Yeah, that being a hero stuff is a no-no.
No. I'm not fighting. There were 2 guys left in the movie, dog. Why are you still fighting?
It's not worth it.
Yeah, no. All right, you've got one more, would you rather? And then I'm going to come in with mine. Hopefully mine is good.
Oh. I know you'd like this.
Okay, go on then.
Because you actually are a sweet talker. Would you rather lose your stethoscope every week or always forget your hospital ID and have to sweet talk security?
Sweet talk security.
Yeah, I knew it. It's not even
I'm sweet talking security, bro.
Yeah, you win every time as well.
I'm tight with everybody in the hospital as well.
Okay, one more. Would you rather misdiagnose a zombie bite as cellulitis, which is inflammation of the skin, right? To some degree, or infection of the skin, or correctly diagnose it and be the first one to get eaten?
Yo.
So here it is. Let me put the stakes on stake, right? So you're going to misdiagnose a zombie bite as just like inflammation of the skin.
Yeah.
Versus, that means you're leading a whole pandemic, bro. You're going to put everybody at risk to say, yo, stay away from people that are drooling on their mouth and walking slow with their heads tilted. Avoid the zombies. Or misdiagnose it and get bitten.
Yeah, but I get bit, but then I go on to bite other people as well. I'm still starting the pandemic.
I hate how smart you are.
But you know what it is, yeah? I'm telling you, in any situation, I would rather be the perpetrator. I'm getting bit. I'm getting bit and biting others, man.
Just a disclaimer, Dr. Michael's a very good doctor. One of the only few that I trust.
I love people. I'm just saying, if there's a zombie apocalypse, if there's a zombie apocalypse, we're all likely to end up dead. And I guess
that's very pessimistic.
You'd rather die first.
No, I would fight my way through it.
How are you killing zombies?
I don't know, but I'll figure it out.
Little Kane. How are we killing zombies, brother? There's no antibiotic for zombies. If there's a zombie apocalypse, take me first.
Okay, calm. I'm gonna dumb it down. I'm gonna dumb it down. Let's do like a little.
If it was a COVID thing, I'd rather diagnose it. I would not rather have it. Yeah,
valid. I'll ask you a little mini ego question.
All right, cool.
Mostly because I might know the answer to this.
Okay, cool.
Because I believe you're the same with me on this regard. You don't care much for the title.
No, not really. No.
Would you rather every patient call you nurse for the rest of your life?
Yeah.
Or have to introduce yourself with your full medical school GPA? And now you got a sexy GPA as well.
I've got a nice GPA. Yeah. I don't mind saying that all the time.
Mine's not too bad as well. Just putting it out there. It might be up there.
So, you know what it is? I don't really care for the title. In fact, every time I introduce myself, I don't introduce myself as a doctor.
Yeah, same.
Yeah, so there's no situation. I've seen doctors that stand up and be like, "Hi, I'm Dr. So-and-so." They love that, and that's their personality.
You know what it is? We need to invite them to the podcast and ask them how much further in life they've gone. And this, there's no disrespect to doctors, but I'm going to say the same thing. Like, every time I've been in Shoppy's, Pick and Pay, Spar, I've had to queue like everybody else.
Right.
I think I've gotten more trouble introducing myself. It was nice, like, oh, my aunt's ankle, my cousin's toe is growing big. What's going on? So half the time, like, even when I'm writing down like my number, right, with regards to patients, right, I don't put the doctor on. I'm just like, my name is Nelson. Full stop.
Do you know what it is? By the thing of getting further, my passport says my profession.
Oh yeah,
brother.
You only got busted in Swaziland,
bro. There's the Swaziland. Okay, so there's two stories. I'll be quick with this one. Okay, there's two stories. The first story is that every time I get on a flight, I get either bumped up to business class, or I get extra leg room. Every time I'm on a flight, because it says medical doctor at the bottom.
You know what? My passport says the same thing. I didn't know this.
You get bumped up.
I'm booking flights from now on.
Yeah, so you proper book economy, and they'll bump you up either to extra leg room or to a business class, right? Because they want you to be in a shout out to
Emirates and everything.
Yeah, shout out to all the flights that are doing that, right?
Appreciate you guys.
Yeah, but there's the downside where last year November, Nello and I take a trip, and we went to Swaziland. Right, we get to the border, and the car wasn't registered in my name, so he asked for my passport, and then he sees that it's a medical doctor, and obviously you know how things are in South Africa. The guy's like, "Yo, you've got to pay for this." I'm like, no problem. I'll slide you 200 rand, and then we can be out. And he's like, "Ow, Dogotela," he says it's not gonna fly, mate.
We don't have money.
And because of the BDU issue, by the way, we don't have money. But yeah, long story short, we go to the ATM and we have to get money because we have to pay up for being a doctor. So there's two sides to it. But then I don't make it a habit to make my profession my personality, and that's why I'd probably just rather be called nurse and be cool with it in the hospital.
You know, to be fair, I'll be called nurse any day.
Yeah,
any day. I really don't care much for it.
Just take all the responsibility away.
In raps.
Yeah.
I feel like, because this is like episode 1 and trial and error with it.
Yeah.
I want to leave it more into the audience's view to like ask us whatever they want to ask.
Yeah.
And just see where it goes.
Yeah.
So if you have any questions, feel free to ask, and we will give you a professional, medical, and not so deep answer to
real.
It.
Yeah.
So, yeah.
Yeah. No, definitely. What
link
we want to do.
Bio.
Yeah. There'll be a link in the bio. Ask your question in the comment section. We'll pick the top interesting questions. And what we'll do is we'll have everybody commenting their questions, and we'll read them in the next episode, and we'll ask them, and everything should go as smooth as we've predicted it to be.
Nothing is off limits, by the way.
Yeah, nothing's off limits. Yeah. Proper feel free. I've got 2 would you rathers for Dr. Nello.
You're asking the wrong person.
Who you guys know as Dr. Mayamba, by the way. It's easy ones. It's proper easy ones. Would you rather treat a patient who Googles everything, or one who refuses to learn about their condition?
Google. I deal with those on a daily basis, guys. I am sorry. I have been instructed to
check my WhatsApp. Do you know what? It makes the experience real.
Yeah, you know what? Producer or the team.
What are they saying?
And my man is telling me about things for the next pod as well. It's not even now. You know. Pardon my cough. Doctors get sick as well. Okay. What was your question?
Sorry, it was the Google thing. It was the Google thing. So the patient that Googles everything, would you rather treat somebody who's Googled everything, or be with one person who refuses to learn, like them?
Nah, allow it. I'm not talking to a brick wall.
Yeah.
My whole thing is, outside of medicine, I fail to understand people that believe their way is the only way.
Yeah.
Like closed-minded people properly like make me irate. Like it's just I get like so about it, because you can take the chicken, the horse, the gorilla to the water. I don't care where you're from.
Yeah.
You're taking whatever you're taking to the water, but they can't drink. You understand? Like you can kill a rat in so many ways. Poison it, get a gun, get a brick. There's so many ways to do one thing. So if you're going to come and say, like, let's present your evidence and mine.
Yeah.
And I see it on a daily basis all the time. Like people come in and say, I've been having a headache. Google tells me it's cancer. I'm like, yeah, you're just not drinking enough water. And we can have like a proper intellectual open discourse about it and then keep it moving. Yeah, the non-listeners, no, I'm sorry, but we can have an open conversation as I always do. My patients can vouch for me. I hope you guys defend me in the comment section, but they can vouch for me. It's always open discourse on my end. Easy. What's the second one?
The second one is, would you rather work in a high-tech hospital in the city, or low resources in a hospital in Boxpits?
Boxpits.
Yeah, Boxpits is in Tsabong, like down south.
Yeah, no, I'm calm. Boxpits.
With like 500 people.
So, I mean...
Low resources, really?
Yeah, with my...
Really?
Nah, hear me out. My thing is like being a creative, right? Dance, music and all of that.
Right. Actively
participating. Yeah. I always love a challenge. I don't think... Complacency is one of the things that I'm not a fan of. I don't like being comfortable. It'll be nice to have like high tech resources. Everybody that comes in can get a CAT scan and an MRI on the house. And no, it's on the okay. House. I mean, obviously, but like it's business. But like it would be nice to afford everybody. But like I think more than anything, I always want to be challenged. I don't like being comfortable.
Oh, sweet.
I don't like simple cases. Okay, you have a headache. Work is stressing you.
Paracetamol.
Yeah, and all of that. I truly enjoy being in the depth of challenges and trying to find a way out of it. So I would be in box pits happy as well. Like I could be doing it for free too, pro bono on the house. I could be doing it pro bono, just genuinely. So I said like prior in the podcast that don't do this because you're looking for monetary value in it. Unless you have the heart to actually help people, it's truly not worth it. Like imagine. I'll give you an example. I think I'm allowed to say it because it's not that deep. But during COVID in Marina, there weren't enough drip stands to manage all the patients. So you'd get the liter of fluid and hang it on the wall in a nail rag. As long as it was hanging suspended by gravity, it would work what it has to do. So it's like we managed to deliver the medication to the patient outside of having the appropriate resources. It's just, it's a different feeling you get of we managed to find a way around the problem without entirely solving the problem.
Okay.
I'll tell you. This is random and probably uninteresting to people listening, but I'll tell you now. I went to take a little kid. I think he was 5 years old. Kept having seizures, febrile seizures. The wording is epilepsy. So like, let's go do a CT scan. Marina couldn't do it, so they sent to Sidileja. So they're like, okay, no, transport the patient, have everything ready in case patient crashes, yada, yada, yada. Okay, cool, we transport. And I was an intern this time. So we go to Sidileja and they cannulate the kid, and their cannula had like 3 pathways, bro. Like you could deliver 3 different things. Like you could give painkillers, anti-nauseas, and something all at once. I'm like, Inini, I just know one. Like if it's one pathway. And they put it in. I was like, I didn't. And you can stop them individually as well. Like,
sweet.
I didn't know we had access to like stuff like this. Sweet. So I mean, yeah. I would. As great as all that stuff is, I think there's a beauty in providing healthcare to people that can't afford it to the best quality that you can. I think one thing I adore about you is your inability to give up, regardless. Like,
that's the thing.
Yeah, I've seen you like in dire situations and still like pull A, B, C, and D together to make E and work. So, yeah.
Yeah. Do you know what it is? I was looking at it and I was thinking to myself, do you know, I think I'd probably much rather practice in a place with resources. As much as I like to pull things together,
not forever.
I don't want to be in a situation where somebody comes in with something as basic as like a fever and a headache and there's no paracetamol.
Yeah, like that.
Yeah, what am I supposed to do? Mix ginger and garlic?
Yeah, I will throw them in ice water.
So I don't know about that one, but yeah, that was my last. No, that was my second. Would you rather? Isn't it? I've got one last one. Be a doctor in the pre-antibiotic era.
Let me even throw my mic away. I don't want to hear this.
Or be a doctor in the future with AI.
Sign me up for AI.
Really?
Yeah, and you know what it is? Yeah. I just signed up to ChatGPT a month ago because I'm old school with it. So I'm like, all this fancy schmancy stuff, I just can't keep up. But I signed up to ChatGPT and it makes my life a whole lot easier. I'll tell you this, I had to do an interview, my first one with BTV about the flu vaccine. And I was like, I could either Google all these facts right now or just ask ChatGPT. I literally, because they sent me like the thing that I need to discuss, right? Yeah. So I forwarded ChatGPT. I'm like, yo, listen, I need you to cross-reference this with the current data and put it in simple layman English for me to absorb. Sent it to me in like seconds. And they're like, do you want me to like highlight it in like point form? I'm like, do it. And I memorized everything in time for the interview. Sweet. So I would think pre-antibiotic is nonsense. If you're gonna agree with that, chat, I'm sorry, because antibiotics have helped a lot, but present day are being abused. I.e., every flu case is.
It's not bacterial.
No,
it's not bacterial.
Flu is influenza.
Yeah,
a virus. Like herpes and COVID and HIV, meaning it has no cure, versus bacteria that require antibiotics. So why are you giving antibiotics for a flu infection unless you suspect that there's underlying bacterial infection? So, and right now, current data from the last CME I attended, continuous medical education, is there's an ongoing rise in resistance to antibiotics.
And nobody's making new antibiotics, by the way. That's the thing that people need to know. Yeah.
This is a disclaimer, off topic. I apologize to the owners of the podcast and my employers.
Shout out to my employer. Love you.
If you are a pharmacist giving antibiotics to patients without a prescription, they do.
Without a prescription?
Yes.
They're not allowed to do that.
I watched it live jive. My man walked up and said, Shahan, didn't flu, I'm coughing. He's like, yeah, cefuroxime. I'm like, alternative to penicillins. No prescription.
Have some shame. If you're watching this, have some shame.
You know you're a pharmacist, pharm tech, and you're giving out antibiotics to someone without a prescription.
Can they do that?
Yeah.
To be fair, it's a business.
Please regulate.
Yeah, that's the next thing we're fighting after BDU gives us money.
I saw a guy, man, and he was resistant to all the oral antibiotics. Only had to get IV ones, and he's our age as well. So, like, I'm thinking, like, what if you're 60, 70, you have a whole life ahead to live?
With endocarditis.
Yeah, what's going to happen to you? So, this misnomer that antibiotics fix everything is not true. Antibiotics are antibacterial. Yeah, unless it's confirmed your bacterial infection, don't be taking those things for the sake of your life, please. Well, pharmacist, I love you guys a million much. I'm a big fan.
Yeah,
but let's stop doing that.
And the mumsies at that, stop requesting that from your doctor.
I heard one guy come in and tell me yeah, I've been coughing. Okay, cool. What have you been taking? He's like, yeah, I was taking some Effaflu and some antibiotics. I'm like, what antibiotics? He's like, yeah, no, I got them from my cousin.
Oh my goodness.
I'm like, wait, that's a double problem. Your cousin didn't finish their course?
Yeah.
And you're just starting.
He's taking the other 4. He took 3 of them. He was like, feel better. I take the other 4. Don't do that, by the way. Finish your antibiotics so that nobody else takes them. But also so that you kill the bacteria.
Also, just to potentially end this podcast, because I think we've been at this for a minute.
Yeah, actually.
If you have anything that you'd like to ask, because that's what this is for.
Yeah.
To just debunk all the questions that you have and discuss all the things that you have, your good experiences, your bad experiences.
That's right.
Please ask us. We will try our level best
to bring it on the next chat.
Hopefully we won't get cut out by a production team.
No, they're not going to cut us out because we're interesting and you guys love us. But what's going to happen now is that comment section, go on there and ask everything, be unhinged. If you're too shy, my Instagram, underscore @ Michael Nyoni. That's it. You can text me there.
Yeah,
follow me. I'll follow back if the
just look for me, Nelson Mayamba on Instagram.
Yeah.
It'll come up as OVO, a fitting room in a shop. Don't ask.
Right.
Just follow. And a huge shout out to Kalafhi Medical Group.
Yes.
Appreciate you guys.
Yes. Show of hands. They've done the right thing. And yes, we're going to get guests in the next episodes as well. We're thinking of having.
Who you want. Tell
us who you want. If you want celebrities, we'll go with celebrities. I've got lots of pictures with big people in Botswana, and
we have the picture of Scar. You know,
I'm telling you, So we're calling Scar out. Tag him in the comments. Tell him to come
podcast for podcast.
Yeah, podcast for podcast because we know he's got a podcast as well. And we know we're
go support the boy as well.
Man. We'll go support him as well and support us too. There's lots of other people that we can tag and bring along. And also shout out to I Am Nello. Shout out to the doctor that's doing music as well. Go and listen to that. He's really good. I think it's a nice feeling knowing that you've got a doctor that is also creative, right? So, and this is why he said that he doesn't care being introduced as doctor because he's got a lot of other things going for him as well. So he doesn't need you to be like, oh, doctor. He's like, nah, Nello's just fine.
You know what it is? It's not even like disrespect to the medical community.
Right.
I fully appreciate and acknowledge what it is.
Yeah.
But I think for me, more than anything, it's about servitude. A lot of people get into it, and I'm going to use Michael's favorite word. They have because I forget, is it propensity or proclivity that you choose?
Proclivity.
Proclivity.
That's the one,
Yeah, propensity, proclivity, inclination, whichever it is. They have the proclivity to attach to the word that, oh, I'm a doctor and you must respect. No, I truly don't care.
Yeah.
If you listen to my 70 plus old man chat with the transport forums, that's really not what it is. It's an honor and a privilege to serve people. Wouldn't have it any other way. But I'm just a human being like any of you. So, be kind to your doctors.
Real.
Appreciate them and let us know what you want to talk about.
Right. That's it, guys. You guys be good. Drink water.
Stay healthy.
Sleep.
Mind your business.
And get the vaccine, man. Get the flu vaccine. Come on, it's free.
Yeah, it literally
Get the flu vaccine, honestly. Yeah, I think that's the most imminent thing now. We'll push a different thing in summer, but yeah, that's it.
And when it comes to Mojolo, do it at your own risk. I'm just
that's
putting
a
it
good
out
one.
That is your own risk.
Really
don't become heartbreak syndrome is a real thing. Read on it.
It actually is.
Yeah, coming with chest pains. Can't you got your heart broke by some woman or man?
What's the word? What's the thing? The heartbreak thingy. There's a clinical word for it.
Heartbreak syndrome.
No. There's another word for it.
Really?
It means a teapot or something like that. Like it means Wait. Sorry. I'm gonna Google it. Cut off the bit when I'm Googling it, please. Heartbreak syndrome.
Heartbreak is real, guys.
Name. Hashotaki, something like that.
Isn't it Hashimoto's?
Takotsubo cardiomyopathy. Exactly, Takotsubo.
3rd or 4th year, I remember that.
Yes,
yeah, guys. So
Takotsubo, shout out.
Yeah, man. Don't date at your own risk.
Yeah.
Love and light. See you on episode.
See you on episode 2, guys. See you on episode 2. Shout out.
Appreciate you.
All right then.